Welcome to the Golden Crane Award-winning Color Success Podcast. I'm your host, Dr. Stephanie J. Wong. Today I have Dr. Zonram Liao. He's a Southern California veterinarian and founder of Wellnergy Pet Products. Dr. Liao grew up in the Los Angeles area in Rowland Heights, California as a parachute kid. We will get into what that is about, where his community played a huge role in helping to raise him. This is why community is so important to him and why he came back to his hometown after graduating veterinary school to be a veterinarian and give back to the community that helped raise him. Dr. Liao founded Wellnergy Pets in 2020 during COVID so that he could help more people and their pets in his community when many animal hospitals were closed or overbooked. I can totally speak to that, so I'm so grateful to him. Luckily, his way to help people care for their pets at home took off and is now headed to retail. He is happy to continue to help people improve the lives of their pets at home and avoid frequent trips to the vet. Thank you so much for being here. How are you today?
I'm doing good. Thank you, Dr. Stephanie. Excited. And thanks for having me on. It's going to be fun.
Absolutely. You're such a positive person. And, when you submitted your information to the podcast, just hearing about your story was incredible. You're such a humble person and you're like, I don't know how much I have to contribute in terms of my story. I'm like, let's unpack this. Okay. Like, first off, tell me what a parachute kid is and how you kind of traversed through your adolescence.
Yeah, that's a good question. You're right. I guess there is a lot more to unpack than I originally thought. After being around more people, I don't realize how uncommon parachute kids are in my community over here. I grew up in Southern California. I know you're from over there in NorCal, Stephanie, but over here we have, in the 626 area or the 909 area, we like to call it we call it San Gabriel Valley. It's a predominantly, I would say almost 60% Asian area. So it's not uncommon for parents who are struggling to provide a living for their kids over here in the United States or find, well-paying jobs to go back to their home country after helping their kids, grow up to the ages of, 16 or so when we can drive and kind of be on our own. And they go back and they work for us and they send us money back and provide for us that way. And we're basically left on our own devices for a little bit. And, even in our school, my group of friends over here, the teachers used to call us the lonely boys in high school, at Diamond Bar High School, because it's just 10 of us. There's 10 of us parachute kids. We just all hung around, everywhere in the community, boba shops, the coffee shops, restaurants after school. We'd spend nights, over at each other's houses because that's all we had. We had each other. And, with upbringing like that, it's very easy to go into, delinquency or go off the rails. Yeah. And I think, with our little community here and that group of friends, we are really lucky that all of us turned out really good. We, because of sometimes, I don't know if it's weird to say, but some of the bad ones they end up going back to the home country and we don't hear from them again. And, we have a lot of other friends that weren't part of the Lonely Boys that were also parachute kids, and they're back in China or Taiwan, and I haven't talked to them in a while. So yeah, luckily enough, we turned out good. And, those people, the community that helped raise us and keep us on the right track, keep us out of trouble after school in restaurants where we would hang out and do homework. Those are the people I do everything I do right now for, as a veterinarian practicing in my hometown. I try to give back to the people that help keep me out of trouble.
It sounds like, as you're describing it, I don't know, we're probably around the same age because you said you're a millennial, that it reminds me of Hook, like the Asian Hook with all the Lost Boys and, and except with boba shops and all that. So how did you stay out of trouble, so to speak? But also you mentioned to me that in adolescence, it wasn't always easy to kind of find your way.
Yeah. So, after school, there's a period of time when you get out of school from like 3 to whatever o'clock, 8 o'clock, 9 o'clock, when you're supposed to go to bed. It's just free time, and a lot of these restaurant owners, they allow me to come into their shops and sit at a table and just hang out, do homework. I pulled 3 chairs together to make a little makeshift sofa and sleep on the, yeah, I would sleep in the restaurants while other customers would come in and eat. And just having a place like that where they say, hey, this is your home, you're okay here, and we can give you food, and the boba's on us, that's what it's about.
Wow.
And outside of that, the Lonely Boys did have one kid who did have his parents here, and his parents took us in all the time, gave us food. We were hanging out at their house all the time. I can mention his name, Henry. His name's Henry.
Hey, Henry.
Hey, what's up, Henry? And yeah, we would all go over, and they would keep us out of trouble. And it's just important for me to give back to people like that.
That's amazing. So fast forward, how did you become a vet? Like sitting in boba shops, did you ever think, you know what, I'm going to save pets and create this, Wellnergy Pet products?
Yeah. Despite, me saying there's a group of kids that, don't go off the rails, I did go off the rails just a little bit in college. I didn't work really, really hard. I didn't really have much of a career. I had a 2.4 GPA, which is really, really sad if you're trying to become a doctor, right? But, after veterinary school, one of my pets, passed away. Mm-hmm. And I just didn't want to go through that ever again. Without putting in everything I could, I knew I was bright enough that I could help, and I might as well put this, brain to good use, and I said the 2.4 GPA or not, I'm getting into a veterinary school.
Let's go.
Let's go, and I'm giving back and helping people and their pets in my community, so nobody has to go through this. So of course you think you're God when you're young, you think you can do anything, but now I know a little bit better. But I'm still able to help a lot of people, and that's when I decided, back then is when I decided, hey, let's be a vet and let's see how many people we can help.
Compassion seems to be a huge thing, and empathy, because as we talked about, obviously I have recently lost 2 of our fur babies, and they were 17 and 16. And I have a third senior, and now I have a puppy, which we've kind of laughed about because he is insane. Yeah. So tell me a little bit more about how we can help our pets lead healthy, long lives and really look into preventative medicine.
Yeah. So I know you have a you have a little puppy right now. I'm sure zoomies is going on all the time. Things in your house are getting, chewed up, slippers, flip-flops, purses.
Oh God, the mute button is fantastic, because I'm just like, hey, like stop with the pillows. It's insane. Yeah.
Yeah, and with these guys, if you can imagine, especially starting at a young age, they're really getting into everything, and they're exploring with their mouths, and they're eating all types of stuff, trying to get a taste, and what they could really throw off the digestive tract, right? These guys, they probably deal with a lot of soft stool, might be seeing diarrhea or vomiting here and there. And really the best way to keep things on track and stop that from happening is to, give a daily probiotic, for example, is a really good idea. Just because whenever this, digestive tract gets messed up from exploring weird things, you have something to put it back in place. That's my favorite way to
put it, and not a nasty way to put it. So that's
cool. Right. There you go. That's my favorite to start on with puppies, and of course with our older senior dogs. You want to be careful of, joint issues. After years and years and years, especially the dogs with weird, anatomical abnormalities, I would say, like a French bulldog or a Dachshund, or sometimes you don't think they look weird, but the occasional Labrador or Husky is going to have weird hips. Okay, and when they get a little bit older, some joint medications definitely will help. Just like we go to Costco and buy, glucosamine and MSM and chondroitin I do it for my parents now that they're back in the United States, and it's certainly a good idea to do that for your dog.
I mean, probiotics are good for humans too, not the
They're
ones
great.
that you sell, but I think, I actually have a Dotson. He's our last senior dog at the moment.
Uh,
And yeah, they have a history of having the back leg problems, right?
mhm. Yep. Their bodies are so long, right? And in between, those vertebrae, is almost like a individual joint, those discs, right? And with a long dog, with any type of force where you're jumping off of a sofa or a couch, they can get intervertebral disc disease, or what we call a herniated disc, where it pushes up on the spine due to trauma. And it's tough for these guys. So joint supplements are great to bring down inflammation in those cases and keep those area in between nice and lubricated.
Yeah, I mean, it's impossible for them not to jump. And that's the thing. It's so hard
Yeah.
because even if you train them, and plus, Dachshunds or wiener dogs are very stubborn. I don't know, maybe it's the personality of my wiener dog, but he is so stubborn.
They say the more stubborn the dog, the smarter the dog. Okay,
Yeah,
so
he's
at the
smart.
very least, you have a really smart dog on your hands, but it's a little bit of trouble when they get a little bit older and they learn all the tips and tricks to get away from you and do what they want to do. A dog's
Yeah.
gonna do what they want to do.
Yeah, I know. And I think that's the thing too, is that a lot of owners want these cute puppies. And, I fell in love with our puppy when we saw him. We had to have a family discussion about whether we wanted to have another puppy because, one, obviously, preaching to the choir. It's so much work, and it gave my husband and I great training wheels to raise our children, because at a young age, having a dog, 17 years ago, that really teaches you a lot about yourself and how to have discipline when you're
Yeah,
cleaning up poop and pee everywhere. But we had the conversation because I knew that once I saw the puppy, it was a done deal, right? Because you get wrapped up in the cuteness. But I mean, how can people assess if a pet is right for them in their lifestyle?
yeah, that's a really, really good question. Like you say, it's as much a family decision as it is anything else. And if you have a family that is, very active and goes outside a lot, goes on these trips, or goes hiking, hey, maybe you're more, apt to adopt a husky or take in a big active dog like that. However, if you are a family that's always on the go and you're never at home, maybe having a dog at that time of your life is not a great idea. So, it's something definitely to assess when it comes to your own personal lifestyle and how you guys want to raise a dog, just like it is, making a decision to have a kid. Of course, mistakes or not mistakes, accidents happen. Sorry. Oh my gosh.
We call them gifts.
Gifts. All right. But yeah. So with dogs, at least you have a little
Don't
bit
worry,
more
we will
control.
cut that out. Don't worry.
Yeah.
Well, I think that it is very important to assess your lifestyle. And honestly, I've always had small dogs. And so now that we have, a golden retriever, it's like the poops are humongous. And like, that's something, I mean, we're laughing about it, but that's something people don't think about, right? It's like, as this dog gets bigger, you may need a shovel.
Oh, for sure.
Yeah.
Uh, yeah. There's no real flush that you can use. This right here. These are what you're using. So get a good pair of gloves,
Well,
or a good hat.
imagine kid hands, right? It's like
Yep.
she's like, "Can I get two bags?" I'm like,
Yeah.
you can take one bag, but it's those little tools there are gonna give you some trouble there.
Yeah, yeah.
Um,
So stay on a good probiotic. Make sure those poops are nice and firm so you're not picking up big soft cow patties.
So, yeah, tell me more about Wellnergy Pet products, because I think it's amazing that you thought a lot about this, because, yeah, it's similar to mental health in that we can't see everyone one to one. And so that's how this podcast was even born. It's like, how can we, through storytelling, give some coping skills to people and be able to also destigmatize mental health? So, tell us more about that journey to help your community.
Yeah, thanks for, bringing it up. Wellnergy Pets is a company that I founded in 2020 when the pandemic first hit. And during that time, I worked for a corporate veterinary clinic with, 1,000 hospitals throughout the United States. So when they make a decision during, COVID to bring our limit in pet numbers down from 35 pets a day, which is usually what I'm seeing, down to 15. Okay, that's 20 pets a day that are not getting, able to get into my door or the care they need. You multiply that by a number of doctors, and you're looking at pets that can't get care. So my schedule is backed up, 4 to 6 weeks during that time. People, we were talking about my community helping me grow up, and I still work in this hometown. And people are letting me know, hey, Dr. Liao, I can't see you for 4 weeks. I can't see you for 6 weeks. And my pet needs some help. What can you do? It was breaking my heart, So, I started off by writing a little blog and sending out little articles to them via email and seeing what I can help do there. And from that, it grew into pet supplements so that they could care for their pets at home and not have to come see me and not have to wait and take that 4 to 6 week wait. By that time, who knows how bad the pet is, right? In terms of the conditions they were dealing with. So yeah, it's really important for me to develop products that are specific for what I see in the animal clinic. We're the only pet supplements company out there where the whole office staff is run by actively practicing veterinarians like me and veterinary nurses. And we see, right now, and then 30 pets a day, 4 days a week, that's over 5,000 pets per year. And so I get all this feedback about what works and what doesn't in the clinic. And I develop these products accordingly. And I'm able to give probiotics for digestive health, fish oil supplements for skin and coat health, and green lip mussel supplements, MSM chondroitin, and glucosamine for joint health. And these are the issues I see the most in the animal clinic.
Yeah. Well, I mean, that's amazing because I can attest, we had pet insurance through one of these larger corporate hospitals, and same 4 to 6 weeks, maybe even longer, just to get an appointment. And, you're thinking about, especially like I mentioned, end of life, and you're like, your pet may be suffering, right? And you're trying to get in even to make this tough decision, even though, it's the quote unquote right decision to stop the suffering. But all the emergency hospitals were saying, no, we're not taking new patients, right? I did find a fantastic vet. This was before when the dog had an issue, and they were telling us to take out, a lot of people were telling us to remove his eyeball, right? That's a huge decision. And so I went on a mutual group that I think we're on, and someone recommended it in our area, and he is fantastic. And why he's fantastic: one, he's empathic, but two, he's not trying to, no pun intended, gouge your eyes out to get every single dollar and penny to like take a blood test, right? When my puppy bit the senior Dotson recently, because he finally fought back, the Dotson was bullying him. But now he doesn't realize his size, right? Like, dude's huge comparatively. So, he had a little puncture. And so we just texted the vet, and he's like, oh, it's cool, just do this. And it's like, that would not happen in a corporate hospital. They would make you come in and like do all this stuff. And I'm not saying like just do like text to your vet as like treatment, but I think there's something to be said about vets that practice in the community that are really interested in helping people and pets.
Yeah, that's what all this is about. It's about helping people, take better care of their pets at home, so they don't need to come in and see me. I don't want to have to, charge you guys an arm and a leg for really serious issues. If we can keep those at bay and take care of your pets at home, little scratch, little nick here, just like when you texted your veterinarian, he gave you some good tips. That's what I like. That's what I want. That's the type of help that, that's what I believe in. Help me help you. And then when there's something serious, then I'll let you know, hey, it's time to do something. But until then, take care of your pet at home. Just like us, we don't like to go in and see the doctor,
Yeah, I appreciate the doctors that will help you, and it's not just about coming on in to
Yeah.
fill billable hours, which is important.
Yeah, and it's important because, there's, we know how to take care of ourselves at home the right way, so we can avoid a doctor's visit. But the right way to, take care of a pet at home is that not a lot of people know, so that's what we're here for, especially here at Wellnergy Pets. So, that's why we have veterinary staff and veterinarians on board, so we can help you guys with that.
Well, tell me a little bit more about becoming a vet. A lot of misperceptions about the process. And so if someone's interested in becoming a veterinarian, what do they have to do?
Yeah, the veterinary journey is a long one, but it's a fun one. I wouldn't trade it for anything else. After college, you apply through a process called VMCAS. I actually write recommendation letters for a lot of students that apply every year. And, there's only 30 veterinary schools in the United States. So it's very, very competitive, and once you do get in, it's about 4 years of veterinary school. Mm-hmm. After 4 years of veterinary school and you pass your boards, most people come out and practice right away, but some people do want to go and specialize, mm-hmm. or, get some extra practice in. And that's where internship year comes into play. And so they apply for an internship year. It's usually done in a large corporate facility or an academic facility. And if you do want to go and specialize, you add another 3 years of residency, take your boards in those specialties such as neurology or cardiology, mm-hmm. orthopedic surgery, or even oncology. And now you're a specialist in that field. And that's how the veterinary process works.
It's extensive, and you are a doctor when you're done, when it's all said and done. And being through that process with a PhD, it is what's flashing back is being a broke graduate student. So let's be real. This is a real podcast. Yeah. How much debt are we talking about? How much time do you put your life on hold? And I'm not saying you don't have to give your specific number when you left, but it's costly. People need to know what they're going into.
Yeah, it's a lot. You're not kidding. Okay. Veterinary school costs as much as, an MD school or dental school. It's a lot. You're looking in the high 6 figures, when you come out of school when it comes to debt. So it's a tough pill to swallow, and people are still, a lot of my friends, they're still paying off their loans probably for the rest of their careers, especially my older colleagues, so it's very, very tough. And, you clench your teeth during that time, just like this.
Eat a lot of ramen.
Eat a lot of ramen. You tighten your belt, and but you're chasing your dream, and for me, it's all worth it.
Absolutely. I was even thinking, my businesswoman mind's like, oh, well, now you should open a school and all this stuff. Right? It is so, I think the thing is, if there's only 30 schools, right, there's less democracy in terms of choice of where to go and like just the dollar amount and all that. And so it is really, really difficult. And a lot of these private professional schools, even in clinical psychology, charge you a lot of money. And obviously, I hope that education is worth it. I mean, I went to a university where they paid our tuition. But those are only anywhere from 4 to 12 spots, depending on the school that you go to. So it becomes really difficult for people who want to pursue their dreams, and there's very little places to do that.
Yeah, it's hard, but we do it. A lot of my colleagues, they do it for the pets. I do it for the people and in my community. So it's all worth it. I try not to worry about it too much. I'm not a great business person per se.
You started your own company. That's amazing.
I know. I'm just a veterinarian first and foremost, trying to help people, and that's what this is about. And I believe if you do good things, you try to help people, everything will come back around.
I think that's true. And I think a lot of times I really wish, and I think people are starting to recognize that now, is that most doctorates should have an MBA component to it. Yeah. Because we're not taught to be business people. We are trying to help people and save them. And there's a savior complex, I think, when we're young to go into it, for sure.
Yeah. It's starting my own business here is definitely a struggle, especially in the beginning. Lots of stumbling, lots of money thrown around, and you don't know where and it's definitely tough. But MBA should be included in it, because a lot of us don't go into corporate. We try to start our own clinics and small businesses, and it is tough. But I guess the money that gets thrown around, for me, that's my tuition for non-official MBA.
It's true. You learn a lot through experience. And that's what I really encourage people to do, is just try.
Try it.
Because yeah, you'll never know.
You never know. And if you have big dreams, you got to try.
Well, and we're in a very happy spot, and I'm very compelled to like end on this positive note. However, I don't want to skirt around the very difficult topic of grief. And I work a lot with people through grief and loss of a human relative, a significant other. But this is the first time that I and my family have dealt with the loss of pets, and they left 4 months in between each other. So they've always been together. And so I do believe that there is a connection. But like I mentioned, it's really hard when also there's children involved, and you're supposed to kind of contain your feelings and their feelings. So I guess I'm wondering, how do you view the grief and the pet loss, particularly since you've been through it personally and you see it professionally?
Yeah, it's definitely a difficult situation to navigate. It's not easy for anybody. People that have had four pets find it just as difficult as people that have dealing with it with their first pet. Okay, you never know. And as a veterinarian, my job to help you guys guide guide you through these waters is to support you guys. A lot of families, they know in here, right in their heart. Those that are listening probably can't see it, but I just pointed to it. They know there as much as we do when we look at X-rays or blood work. You know what a happy, for example, my dog Nana. You know what a happy Nana looks like. You know what a sad one looks like, and you know one that just doesn't look like her anymore.
Yeah.
And when it gets to that state, then you might know it's time. And my job is to support you guys 100%. It's not to talk you guys out of it. It's not to throw everything at them. It's it's weird to say, but it is a blessing that we have in our field, that we're able to end the suffering.
To choose. Yeah.
Yep, to have that choice. The fact that we have that choice is a blessing. So it's not easy. It's definitely not easy, but that's what we're here for. And it is weird. It's a way to still help people.
So that's a great way to frame it, because you do know as a pet parent when, or at least we did, when it's limited time. And I think one thing that's really difficult is when to differentiate, though, when to come see a vet, because, for both of our boys, they were eating, drinking, going to the bathroom. I mean, one obviously was drinking like nonstop. So we knew something, he would just stare off into space. So we knew like it was getting there, but he was still eating and all that stuff. I mean, when physically and mentally is it for the dog, for these fur babies, is kind of where you're like, this really is the time, because I think there's a fine line.
Yeah, there's definitely a fine line. So what I tell my clients is, it's as much a family decision as it is a medical decision. And when I say in your heart, is when you see that pet is just not themselves, and you're trying your best as a pet parent. You're trying your best to help them, and you don't really see a light at the end of the tunnel, even though you're trying your best. And when it comes to that, and you're feeling like that, and the dog is just, or the cat, or just the pet just doesn't feel like themselves anymore, then it might be time, and come and you talk to us as veterinarians, and we help guide you through that. And sometimes it's just the hardest decision. It's just the hardest decision to let go and say, okay, it's time. And that's why it's so important for me to support you guys. It's so important for me to support pet parents more than and help them make that decision more than talk them out of it. It's already a difficult decision. It's really something that's so brave for my clients and my pet parents to even bring up with me. And I already applaud them for that. And I'm usually very straightforward and honest about, the blood work and the medical, how much time they might have left, their quality of life. And is this something you want to do?
I think that's amazing. And that's so empathic, and really talking with the family is just so important, because usually, when we went in, we are already decided. And I think the veterinarian knew that, and just stared at the dog for like 5 seconds. I was like trying to think, is there a way to kind of prolong his life? And he was like, no, I think, this is the right decision. And that's really validating, when someone doesn't try to talk you out of it, and when there really is no medical evidence to do so. So as you can see, like I mentioned before, I put, the ashes of our firstborn, behind me here. I try to, like, now the new thing is to like decorate this side table for the guest. And like, so what can people do after they've decided, after the pet is physically gone, to memorialize, to cope with some of this emptiness and this grief that we feel?
Oh, that is a tough one, right? So, it's no matter how many times you go through I've had 3 pets, I know you've had a number. It feels like your heart is literally shattering, doesn't it?
Mm-hmm.
And it's even a little, it's gut wrenching. So that feeling, you have to feel it. You have to feel it, because it, for me at least, it's directly reflective of all the love that was there, all the love that was there. And the next week or so after a pet passes, you're going to spend time, looking at their spots in the house, around the corners.
Oh, thank you for saying that. I know
Yeah.
that's the weirdest part, I think.
Oh, yep. That there's spots in your head, and when you look there, it's like almost like there's a shadow there that's still there. And so during that time, that feeling that and getting used to it and understanding, okay, it's happened, is the most important. As far as, dealing with how to memorialize your pet, everybody and every household and every family has a different tradition and a different culture. And I think however they want to approach it, there's no right or wrong. Whatever just helps you and your family deal with the loss of a family member is the best, be it spreading the ashes out in the ocean, having the ashes back in a box, as long as you still feel the love there, and you can help cope with that loss, you're okay.
Yeah, we plan to spread them. Obviously we're waiting on our second's ashes as well to kind of
Yeah,
decide when to do that. But
I'm so
I'm glad.
sorry.
Thank you. I'm sorry for you. I feel your pain, and I think pet parents that have that loss truly understand how heart-wrenching it is. Yeah. So, another thing that I really encourage too is to, I know people have phones all the time to take pictures and all those things and videos, but as we were going through past videos, on Google Photos and all that, or videos, we weren't even meaning to film them, right? But they're
Yeah,
always there in
present.
all these videos, right? You find, it's almost like Where's Waldo? You find their little face somewhere, or their butts or something like that.
Yeah,
But we obviously always celebrated their birthdays and everything. But I think what's important is to really cherish their existence, because we know that their lifespan, is just so much shorter than a human lifespan. And so, like you said, having 3 losses in your lifetime, and to not discourage people from having a pet again, because I think a lot of people shut down and are like, I never want to feel this pain ever again. Yeah. Well, I mean, thank you for talking about a really difficult topic,
Yeah,
because it's not really talked about. And I think grief
it's
in
not.
general is just, people don't know what to say when you lose a human, but even more so with pets. Some people don't get it. They're like, what the heck, it's a pet. But to
Yeah,
me, it was my first child. It was my second child, right? And
yeah,
so it's a very different process. And especially when you work from home, it's like you were talking about, oh, you just expect them to be on this certain part of the couch or at the water bowl or something,
yeah. It's not easy. It does feel like your first kid or your second kid, and it's weird for people that don't have pets to empathize with it. But most importantly, what you talked about is it's difficult for people to talk about. That's why I'm glad I have a position as a veterinarian that I can help people open up a little bit and talk about it. What we see, most often, and what me and my nurses see in the clinic is usually a big, burly, older dad with a tiny little dog. And he's always been kind of rough in that animal hospital. Every year with vaccines, we talk about his ears, ear infections, eyesight going down,
Mm-hmm.
things like that over the years. And when it comes to that time and that day, the one that is in the biggest ball of tears is that dad, because they have no idea how to express how their bond with this
Yeah.
weird furry little animal that's been part of their family, and why it hurts so much. And so uh, I'm glad I help people navigate through that, help them guide through those tough times at the very least. At least I can do.
Well, shifting gears just a little bit, I've been asking this question of our recent guest of, what's one question you wish someone would ask you, and what would your response be?
What's really weird about this question is, you think about uh, people out there that would ask you. And I know it's weird. We just talked about death, but and this is kind of like my own. I grew up in LA, so it's not uncommon for me to think of my childhood hero as like Kobe Bryant. But
Mhm.
I would like to answer him, if he ever asked me like, hey, what are you doing here? And well, they talk about it like the Mamba mentality, okay? But
Yeah.
it's like, hey, what are you doing here, and what are you doing to become, the best at your craft, and or find your little niche and become the best at it, and I would like to say I'm holding up that Mamba mentality pretty well. I'm grinding every day, trying to become the best doctor I can be, learning new techniques in surgery. I'm just going through books and videos and learning from the best, and also, just providing for people the best I can. And it's weird that you think of it in veterinary health or veterinary medicine this way, but I do think of myself as a little bit of a servant. I'm serving my community, and I'm doing that to the best of my abilities. And I hope an answer like that will make him proud. Even though he's not here anymore, and he's not, a family member or anything like that. But that's something, in terms of celebrity wise.
Well,
I
he
guess.
meant so much to so many people. And,
Yeah.
I remember we were in an airport when we found out about it, and
Yeah.
we thought it was a joke, right? Because there's all
Yeah.
these hoaxes online
Same
on,
here.
but unfortunately, no matter what you think about TMZ, they tend to report accuracy.
Yeah.
So
Yeah.
you hear it on TMZ, like, oh, you're like, oh, that's true. But, I think despite not personally knowing certain celebrities, it's still, their legacy really touches
Yeah.
people. I mean, maybe you did know him, maybe you treated his pet,
No.
but that, I think that's really well put. And it's not just, his mentality is not just specific to basketball, right? That was the
Yeah.
beauty of his mentality, is that it's about personal development and growth.
Yeah. Yeah. That's what it's about. When I think about someone asking me a question, I also think about, or I think about my grandpa. And my grandfather, he's passed away when I was about 7. And he was a doctor in Taiwan. And he was a OBGYN, and the only one in his little city over there. And he treated almost, a third of the country. Everyone over there went to go see him. Yeah, he was the first one in that little town, first one when the town got bigger and became a city. And he was well known. And after that, he immigrated to the United States and became a businessman. And, I'm trying my best to follow in his footsteps, but I don't know. I sometimes just wish, I could ask him questions more than he could ask me. But if he asked me if I'm making the family proud, I hope to be able to say I am one of these days. So there you go.
You are the first person to have 2 questions and responses. I love that. I think that's amazing. And for both of them, I think they're relatable. Your grandpa seems amazing. And the fact that you're sitting here and smiling, and it's a genuine smile. That's the thing, is it just means so much to people to have someone with a smile. You can't even imagine what it's like to go into a vet hospital and someone looking like death already. You're like,
yeah,
woo!
it's tough. That's why it's weird to talk about this already, but I am planning to open my own clinic one of these days. And
I know you should. I don't use should words very often because I always say tell my clients could, not should, but in this case you should.
Yeah. Yeah, I hope it's coming. It's coming in the next year or two. But the name of the clinic I already have ready. It's the Sunshine Veterinary Corporation, right? And I think it's important that in a field that's very tough, and I know we didn't talk about this before, but in a field that's very tough, that you do smile a lot and you do serve, and it's good. It's good to just be of service instead of be like, I have to go help this pet. I have to help these people. Hey, I get to help these people. I get to help these pets, and let's do it. Let's get these guys better. Yeah.
Well, I already thought of your marketing tagline: "Care with a smile."
It
has to have your big smile on it.
That's all credit to you. You mean this bucktooth smile?
Oh God, it's so positive. I think that is so important, and that's a good point, is to just watch your burnout too, because when you're talking about being in a corporate hospital, and nothing against them, but the volume, right? People can get really burnt out. And so just really the perspective shift of how do you provide quality care and still help the most people possible. You have to come up with really innovative ways for treatment.
It's important you touch on that. I know we're on a podcast with a clinical psychologist, like Dr. Stephanie Wong. It's important that you talk about burnout, as veterinary or mental health in the veterinary field is so important. There is a lot of burnout. The veterinary hospitals are severely understaffed. The staff that are there are severely overworked, and there's the pet to doctor ratio is so off kilter right now. And especially after COVID, where there's been a 15% increase in pet ownership, the statistics, is showing that by 2030, you're looking at 75 million pets that don't have care, and that's a lot of pressure to put on veterinarians out there who are swimming in debt. The income is nothing, related. It's so off versus the debt versus, and then, you deal with that. And then on the other hand, you're also dealing with misplaced anger from pet parents, sometimes dealing with frustrating chronic issues that it's hard to relate with people. You tell a person they have an autoimmune disease, they understand what's going on. You tell a person you're dealing with lifelong allergies or arthritis, they know what's going on. But you tell a pet owner that, sometimes it's difficult for them to understand. That's why it's important to communicate that with them. But all these pressures of a veterinarian drive a lot of them into burnout,
Yeah.
So I guess the only message I had and I want to touch on, at least that now that I have this little platform, is just be nice to your veterinarians, please. we love your pets. We love you guys. I certainly do. I love the people in my community. So and I'm gonna put on a smile and treat your pets. So just some of my colleagues are having tough times. Just be nice to them. My veterinary staff, be nice to them. I love everyone in my field. So I don't want to lose. It's a tough subject, but I don't want to lose another colleague or to burn out.
And I think in general, people just be kind to others. I just think,
Yeah.
it's just people are even more irritable. And as we know, the increase in Asian hate crimes is just, it boggles my mind, even as a clinician, like how much just out of spite, out of hate, people do some nasty things. And not to go to the other side of humanity, but I think, that's the overall message, is just be kind to people. They're trying to do their best.
Yeah, they are. Everyone's doing their best to, give them a bravo, give them a clap, give them a little skip back a little bit. That's what it's about. And yeah, I think the world would be a better place with that type of mentality.
Yeah. And again, I think just to put this out there to people, I work with a lot of tech professionals, and I really think that big companies, as a carrot on the stick, really is to offer pet insurance or ways to, subsidize some of these costs, because even for those that have pets and children, or even just have pets, um, it's expensive. It is really expensive. We have childcare subsidies. Why not fur baby subsidies?
Oh, for sure. It's expensive, but a lot of times what's shocking, is because it's an unexpected expense.
Mm-hmm.
Because you're expecting to get a dog or get a cat. It's all sunshines and rainbows, and you don't expect them to get sick because it's just a dog, And growing up as a child, when you have a pet, you're not dealing with the financial side of it. You're just dealing with the licks in the face, the little nibbles at your toes, and that's all you're dealing with. And you think as an adult, that's what you're dealing with as well. But it comes with a whole lot of other issues,
Yeah.
But luckily, the issues that we're trained for to help you guys with. But hopefully, it's just bringing light to the expenses that come to pet parents. Just don't forget that there's a little stuff right there.
Yeah, I think too, I've always had fish growing up. My parents would let me have dogs. And so it's like, when you think about it, people think it's kind of like that, right? The fish passes away. Hopefully you were able to keep it alive longer than than not, but
Yeah.
people flush it down the toilet, right? And it's
Yeah.
like, or at least parents do for their children. And so it's not as A to B as with fish, right? And
Yeah.
there's a complicated process to it. So,
Yeah.
but where can people find out more information about Wellnergy Pets and keep updated on your clinic, which I feel is going to be booming, especially, with that marketing
I
tagline that I
know,
just gave you?
right? Oh my goodness, that's so awesome. You deserve all the credit. I'm definitely going to be taking that. Just be warned. That's great. And in terms of Wellnergy Pets, you guys can find us at www.wellnergypets.com. You can find a whole line of supplements to help your pets with, dental health, which is the number one issue in pets, skin and coat health, digestive health, arthritis. And we even have some herbal medications developed in conjunction with traditional Chinese veterinarians over there in
amazing.
the other side of the country. So yeah, to help your pets with weight loss and metabolism, as well as their hip and joint care. So check us out, and you can always follow us at on our Instagram page and Facebook pages as well.
They're doing amazing things, everyone. And for those that have pets, which pretty much is most of us, these supplements will really, really help. And so I thank you so much for being here, sharing your expertise, sharing your smile. It will be on YouTube. So, you're going to send that to everybody, but thank you so much for taking the time out on a Sunday to share with us and with me.
Not at all, not at all. I'm happy to do so. So yeah, everyone check out Dr. Stephanie Wong. Thank you so much for having me on. This was a ton of fun. Let's do it again sometime.
Absolutely.
Yeah.
Absolutely. You're always welcome.
Thank you, thank you, thank you.
Thank you so much for listening to the Color Success Podcast. Listen, like, subscribe on all major streaming platforms, YouTube, IG, and if you want exclusive content, you can join our Patreon. All links can be found at colorofsuccesspodcast.com.